So I'm Lucy Foulkes. I'm at UCL and Anna Freud Centre at the moment, but I'm moving to Oxford in January to start a fellowship looking at exactly this problem. So it's a great opportunity to talk to you, and I'm interested in your perspectives because I'm particularly talking today about how I've been influenced by other disciplines in my thinking. So I'm an academic psychologist, but I'll talk a bit today about how sociology and philosophy in particular have influenced my thinking. I'm interested, are there any other psychologists here? Okay, one. And what's everyone else's discipline? Are there philosophers mainly here? Psychiatrist? Yes. Anything else? Any sociologists?
Clinical theorist.
Okay. Anything else?
Biologist.
Right, okay, great. Yeah. I know who you are, it's fine. Okay, so I'm hopefully not going to butcher these ideas too much, but I very much want to talk about how these ideas have influenced me as a psychologist. So I'm interested in this question, the problem with mental health awareness in secondary schools, which potentially is a bit of a controversial title, but I'm not doing it for the sake of it. I genuinely am interested in the idea that things are going wrong in secondary schools with the way we're talking about mental health at the moment, and I think we need to talk about that. I wrote a book about how we're talking about mental health more generally in society that came out about a year ago, and I was really surprised and encouraged by the reception it got in terms of how many people emailed me to say, often sort of off the record or confidentially, I agree something's going wrong with how we're talking about mental health. So that's what I'm talking about today, specifically secondary schools. So I'm very interested in adolescent development specifically, and I think there's potentially something distinct going on in that respect in terms of secondary schools, but there's obviously overlap with primary schools. Oh, went up, it's down. Okay, so what's the context for this? So within the last 10 years or so, we've been encouraged to talk much more about mental health. So there've been lots of public health campaigns and charity campaigns that can essentially be summed up with this message. So talk more about mental health, talk about your own, ask about other people's. It's a sort of universal good to talk about your distress, label it, seek help for it. So that's one key message, that we should talk about this. And then in parallel, there have been various campaigns about specific disorders, so like PTSD, World Bipolar Day, Eating Disorder Awareness Week, OCD Week. And the message of these campaigns have been that specific problems have names, and that we should use those names as well. So broadly, people are really being encouraged to talk about, notice, label their mental distress, sort of negative psychological experiences. And this has obviously trickled down into schools. So now we have Children's Mental Health Week. You can wear yellow to raise awareness about mental health, or green, depending on the campaign. There's been a big initiative by the government in 2017 to try and see schools as a site for mental health awareness, mental health intervention, places where we should treat and ideally even prevent mental health problems from ever beginning. In terms of so this initiative was about getting trained senior mental health leads into every school, and then these things called mental health support hubs with a specific workforce that was trained to give low intensity psychological interventions. And that's being rolled out right now across the country. So this is, which Emma already mentioned, this kind of comes under the umbrella term, the therapeutic turn in education. Now this is a sociological term, I think, or that's how I've come across it. And even just reading this term was really useful for me. It made me realize, okay, this is a cultural phenomenon, and there's been a shift. We didn't always treat schools as sites of mental health intervention and prevention. And because my training in psychology has always been at a time when this has been considered to be a good thing. So this was useful for me to think, actually, this has been a shift, and it's possibly a shift that we can kind of critique and question. So this is the question I've been asking myself for a long time, and I'm kind of cautiously going to ask you today. Is it a good thing? Is it universally a good thing to encourage teenagers in particular in schools to notice signs of distress, to label them, to talk about them, to seek help for them? Is that always a good thing? I'm going to cautiously answer no, but I'm going to do it respectfully because I'm very aware that in parallel with this conversation there are lots and lots of teenagers who are experiencing acute distress at the moment who really need much more help than they're getting. But while that's true, in parallel, I think there's an issue with how we're talking about mental health more broadly. So what's actually happening in schools? So the thing I'm going to focus on in particular today is mental health lessons. So not like one-to-one counselling, more lessons. So there's this phenomenon called universal interventions. And the idea here is that you go into schools, you either train up existing teachers or you bring in someone outside and you teach whole classes about mental health. So you teach them about mental health problems, things like anxiety and depression, what they are, how to spot them. And then critically, you give them some tools, some coping tools to try and cope when it happens to them. So for example, mindfulness exercises or CBT, cognitive behavioural therapy exercises. So the idea of these lessons is that if you teach everyone, well, firstly, it makes sense to teach in schools because that's where young people are. If you teach everyone, then it's more fair, okay? You don't have to pick out the people that you think are going to have a problem. And on paper, it's a lovely idea that if you could teach people some coping skills, then you could get in before the problem even starts. And then 12 months later, when they start seeing some signs of depression or they're unhappy, they can draw on those tools that they learn about in class. So it's a great idea, but unfortunately, there's starting to be emerging evidence now that universal interventions don't work all that well. So there was this meta-analysis came out in 2021, which I think is a good one, which looked at universal and targeted interventions. So targeted interventions is where you select the group that you think are more at risk and you give the lesson to them. So this looked at universal and targeted interventions, and it essentially shows, on average, they don't do very much. They either don't work at all or they work a little bit. So maybe if you give people a depression or an anxiety questionnaire before the intervention and then at the end of the intervention, on average, teenagers might drop a couple of points on this questionnaire. But generally, if they do follow up, and often studies don't follow up, that effect hasn't survived 6 months or 12 months later. Personally, I don't think it's all that surprising that universal interventions don't work all that well. I think a useful analogy is to think about physiotherapy and the idea that inevitably some people will develop musculoskeletal pain and problems. So maybe we could go into a school and teach people all about different pain disorders, different musculoskeletal problems that they don't yet have, and then tell them 12 months down the line when something starts hurting, these are the exercises you should remember to do. I don't think it's all that surprising that the teenagers end up not using those coping skills, or that they're not good enough. I mean, the other problem is that within that classroom, you're going to have people who have much more severe needs that this don't help. But you could argue if they help a little bit, then why not just do it, right? And I totally understand, I'm not criticising schools. I understand why schools want to do it anyway. They're desperately trying to figure out the solution to this problem of lots of adolescents being distressed. And the idea is, they can't afford to give everyone one-to-one therapy. CAMS isn't doing enough for enough people. So why not? It's better to do something than to do nothing. But what I'm getting really interested in, and this is what I'm going to look at in more detail in Oxford, is that actually for some people, these might not just be sort of mildly effective or ineffective. They might actually be causing harm. So there is some evidence now building that for at least some subgroups of teenagers, they're actually worse off having these interventions than not having them at all. So first, I don't think that's surprising because all psychological therapies, the ones on which these interventions are based, can cause increased distress for at least a subset of individuals. So it shouldn't be surprising that just like any medical intervention, so it shouldn't be surprising that when we lift those interventions and those concepts into a school setting, some of the people might get worse. It's a reasonable hypothesis. And in the last year, there's a meta-analysis came out and a randomized control trial came out showing that the group of teenagers who were taught CBT skills in school ended up with increased internalizing symptoms, so increased symptoms of depression and anxiety relative to a control group that didn't have the intervention. So the teenagers were worse off learning CBT than not learning CBT. Obviously, there's other studies that have shown the opposite, but there is at least some evidence showing that this is the case. And then most recently, there was a trial led in Oxford called Myriad that taught mindfulness lessons in schools. So they specifically trained up existing teachers to teach mindfulness. And they found that on average, having the mindfulness lessons relative to regular PSHE lessons didn't increase or decrease depressive symptoms, but for a subset of adolescents who had elevated symptoms to start with, they were worse off than their equivalent people with elevated symptoms who just had their regular PSHE lessons. It was a small increase. It wasn't sort of clinically significant, but it was still an increase. And I still think this is an interesting, we're at a point now where we need to start asking a question whether at least some of them are getting worse from this and why that might be. Then there's this qualitative quote, which I really like. I think this was a 15-year-old who had CBT lessons in schools with the goal of, it was a program to try and prevent depression developing. So she said, I mean, it's like you start thinking like that you have low thoughts because the teachers bring it up all the time, negative thoughts, and that you should change that all the time. But those who sort of have positive thoughts, they start thinking negative in the end. It's little pockets of really powerful qualitative evidence that some teenagers feel like this. They feel like there's too much of a focus on their negative thoughts in a way that's actually really actively unhelpful, which actually shouldn't really be surprising, I don't think. So to bring back to the other disciplines that have helped inform my thinking, this is what I started to become interested in. Is this a good thing? Is it useful for everyone that we've started talking about mental health much more in schools? So I'm going to talk about two concepts from other disciplines that I found really helpful. Firstly, from the sociologist Catherine Eccleston, this idea of a diminished self. So she's written this book, I think in 2009 with Dennis Hayes. And again, even this title, so The Dangerous Rise of Therapeutic Education, is informative and useful, I think. You don't necessarily have to agree with it, but I think it's important that some people are starting to ask the question, that we shouldn't just assume without question that these cultural shifts have been a good thing. So one thing she talks about specifically about this therapeutic turn in education is this idea that it's making the individual adolescent or child, she talks about primary school as well, more vulnerable. So this is a quote from her. So despite the rhetoric of empowerment, discourses of emotional well-being and engagement reveal a pessimistic tone that privileges damage, vulnerability, and fragility. So this is interesting. She's talking about the rhetoric of empowerment as well. So these are well-intentioned ideas, and the purpose is that if we arm people with information about what mental health and mental health problems are, then that's empowering, that's useful because it can lead them to better understanding themselves and getting help, which obviously doesn't always happen. So I think she's questioning this idea that even with those intentions, what's the message that we actually end up giving to them? And then she mentions here Frank Furedi, who's another sociologist. So she says, Furedi presents a strong case that there is a growing cultural perspective that regards most forms of human experience as the source of emotional distress. Again, it's interesting to come back to this idea about the broken heart that we mentioned earlier. Interventions based on such beliefs create a popular view that to a greater or lesser extent we are all vulnerable and emotionally damaged by life events, but that some groups and individuals are especially damaged. But this is really interesting and complicated because obviously for some people this is true. There really are people who are emotionally damaged, to use their phrase. They're vulnerable. They need much, much, much more help than they're getting. That's true. But what these academics are saying and sort of almost giving us permission to think about is whether there are some people for whom this is not useful. I've also become very interested in this idea that not only is it unhelpful to call someone, say to someone that they're vulnerable, but that can you actually end up creating or engendering that vulnerability through a kind of self-fulfilling process. So this is where the second idea is really useful that I've taken from kind of outside psychology to inform my thinking. And this is the idea of Ian Hacking's looping effect. So this is a philosopher, which I'm sure many of you will be familiar with. So he came up with this idea that by classifying an individual with a label or sort of putting them in a box, that box or that label, that concept becomes solidified and real in the world in a way that it wasn't before. So he talked about, I'll unpack this in a minute, but he talked about this, he wasn't just talking about mental health, he was talking about, for example, obesity and the concept of being a genius, so, and various other things, but also it's very relevant to the idea of mental disorder. So I'm going to explain this, but using the idea of social anxiety disorder. So social anxiety is a real phenomenon in that some people feel exceptionally anxious regarding social interactions in terms of being judged by other people to an extent that can be absolutely debilitating. That's not to be debated. But this idea of the point at which we put a boundary around it and call it a disorder, or whether we ever call it a disorder, that's kind of more malleable and up for debate. But for example here, if let's take a scientist or a doctor or another professional who determines that an individual has social anxiety disorder. What happens then is they become aware that you've given them that label, and then critically it starts to alter, or could start to alter, their behaviour and their self-concept. So for example, if you tell someone they have social anxiety disorder, they might think, I'm someone who has social anxiety disorder, therefore I can't give a talk in my school, therefore I'm going to have to pull out of it, or I can't go to that party because of my social anxiety disorder. But the looping effect bit that he was talking about is that once these changes happen within the individual, that individual turns up again to the research study or to the doctor's office, and their sort of new self-concept and behaviour starts adjusting what the professional thinks about them. And it's an iterative process where the academic or the professional updates his or her understanding of the disorder or the concept. And through this looping effect, this concept and this type of person becomes real in a way that they didn't exist before. So this is a useful quote from him: "Our sciences create kinds of people that in a certain sense did not exist before." And I found this really, really useful for thinking about what's happening in society at the moment, but also in schools. So this is this diagram is by Tekin, that's why I've mentioned her as a reference here. But this is his later work where he's sort of complicated his looping effects idea a little bit by saying it's not just about scientists, which I think is correct, but that there are other experts, there's kind of knowledge more generally, and there's institutions that we all sit in, and that there's this sort of web of loop effects and interactions in which our understanding of ourselves, how we behave, how we think about ourselves is kind of repeatedly influences and is influenced by all these other institutions and people around us. Now, I found this really useful for thinking about secondary schools, because what's the kind of key institution in which teenagers are embedded? It's their schools. So it's very reasonable to think that what's happening in schools, again, very well intended, I'm not criticising schools, but that the way in which they choose to or are being made to tackle mental health and try and help people might actually be sort of contributing to and exacerbating this sense of people personally experiencing a crisis. So if we think back now to what's happening at schools, so and how I find those ideas useful to come into what I know and understand as a psychologist. So my specific area of expertise is about adolescent mental health and adolescent development. Two key things that are happening in adolescence. So I'm writing a book about adolescence at the moment. I'm interviewing lots of people about their adolescence. And it's fascinating because the two things that it keeps coming down to is that adolescents are trying to figure out their identity. They're trying to figure out who they are. And they are deeply influenced by their peers because they really want to belong within a peer group. So that's my understanding as a psychologist of what's happening in the classroom, and I'm writing something at the moment about why those two things should be considered a bit more when we're designing group interventions in schools. But now bring in those ideas that I talked about from philosophy and sociology, okay? So the idea that well-intended motivations to make people aware of their vulnerability might actually be unhelpful, and that actually there can be this iterative process of once you label someone or make them believe that they have a mental health problem, that can actually become self-fulfilling. So I find it really, really useful to bring in these different ideas from different disciplines to inform my thinking as a psychologist. I think what's interesting about what's happening in schools and what's happening in society more broadly is that it's complicating our understanding of whether there's a mental health crisis or not. Now, it's interesting that you used that term, Emma, there was some question about it. There's a very popular narrative at the moment that teenagers are experiencing a mental health crisis. And it has been for quite a while, actually. And one thing I found interesting was that we were saying there was a mental health crisis before the pandemic, and then the pandemic had happened. I was like, oh no, now there's a crisis, you know. And it's almost like, I think the next thing it was like, well, we'll have to try and emphasise that this is a crisis when we've already sort of reached ceiling in the kind of language that we're using. But everything I've talked about up till now, how does that inform our understanding about whether there's a crisis or not? Well, firstly, in a very firstly, there's different ways you can think about it. There's a crisis in terms of healthcare and people not getting access to help that they need. That's fairly uncontroversial. The more complicated thing is whether teenagers now, on average, are worse than they used to be. And in a very straightforward way, yes, they are. So if you ask teenagers today to fill in questionnaires about their mood, anxiety symptoms, self-harm, etc., they report more of those behaviours, more of those feelings than they did even 3 years ago, 5 years ago, 10 years ago. More teenagers now are reporting that they're unhappy, symptoms of depression, symptoms of anxiety, etc., than they used to. That is true. But I'm very interested in why they're reporting more of these symptoms. So my understanding, I laid this out in a lot of detail in my book that came out last year. I think there's 3 possibilities, and I think they can all be true at the same time. One possibility is that reported rates of problems are going up because things really are worse than they used to be. I'm not remotely interested in discounting this. I think this is valuable and important. There's lots of reasons why it might be the case. So firstly, obviously the pandemic happened. My understanding of what's been published so far is that certainly a subset of adolescents for whom the pandemic was really problematic in terms of their mental health. Probably people who were vulnerable already for various reasons, such as having special educational needs or lower SES, for example. Social media, I think some people want to blame everything on social media. Some academics are too readily discounting social media. My understanding is that there are certainly some adolescents who would have been better off growing up in a generation without social media in terms of their mental health. I don't think it's harmful for all of them. I think it's beneficial for some of them, but it's a reasonable argument to make. There's another argument that things are getting worse because education is genuinely more stressful than it used to be. The stakes are higher in terms of getting into university and university being more expensive. So there's lots of legitimate reasons why things really might be getting worse. But I'm interested in 2 other possibilities as well. The second one is that reported rates might be increasing because we've usefully informed people better about what mental health problems are. And this was the whole goal of those campaigns, okay? But if you teach people about what depression is, then they're probably going to better recognise previously under-recognised or under-reported depressive symptoms, which means they'll tick that box, which perhaps someone in a previous generation should have ticked, but they didn't understand what was going on, or they've experienced too much shame or stigma. So this is a good thing, but it's still going to make it look like teenagers have more problems now than they used to. The third possibility, and again I think all of these things can be happening in parallel, is the one that I'm really most interested in. And this is the idea that because of all this climate of talking about mental health problems, teenagers are now too readily experiencing, interpreting their problems as symptomatic of a disorder or a mental health problem. I'm not blaming them. I think this is the reason why teenagers are labelling themselves with these problems is because this is the language that we've given to them, okay? This is what schools are using, this is what the campaigns are using. So I'm not blaming them, but I think this is a really important possibility. So just as an example of why this number 3 is quite sort of complicated and interesting, I want to show you this. It's an example that's used by psychologists to measure symptoms of emotional distress, essentially, in young people. And if you score a high enough number, they would say it might be indicative of clinically significant levels of distress. So if you just want to have a look at that list for a minute, so so the question is basically like, how often have you experienced this in the last 2 weeks? And if you tick never, then you'd get a 0, sometimes 1, always 2. But I think what's really interesting is that teenagers today answering these questionnaires, which is the information on which we base all those discussions about a crisis quite often, they might interpret the questions in a different way to a teenager a generation ago. So for example, look at the question, the item, I am unhappy. Well, if you're repeatedly being bombarded with the message that you might be unhappy, or that there's this thing called unhappiness and this thing called depression and it's really common in your age group, then perhaps you'll be more inclined to tick sometimes. Even if an equivalent person in a previous generation experienced exactly the same level of unhappiness, they just wouldn't have labelled it or conceptualised it as such. Even things like I cry a lot or I worry a lot, or what does a lot mean? Perhaps if you do it at all now, you feel like you're doing it quite a lot. And this was a useful quote from a psychiatrist, Stanley Kutcher, saying, youth self-reports of negative emotions are increasing, but the self-report scales used in studies documenting this have not been calibrated for generational changes in language use. Now, it would not be straightforward to try and calibrate them for generational changes, because then you wouldn't have a like-for-like comparison. But I think his point still stands. I think this is still a component of the problem that we need to think really carefully about. So just as I come towards the end of this talk, I want to talk about what I'm working on at the moment, which is what I've mentioned earlier in the talk. I think number 3, when we too readily interpret negative feelings as mental health problems, I think this actually can become self-fulfilling. So it's not just that we misunderstand and think we have depression and we don't, but actually by doing that and thinking we have depression, it actually can end up leading to depressive symptoms. So I want to explain how I've laid this out. So this is, it's not published yet, it's a preprint. I've not actually talked about it with anyone apart from my collaborator, Jack Andrews. So it will be interesting to get your perspective on this. So we've tried, I'll just sum it up here actually. We've written this paper, this hypothesis, so it's an idea, and we're arguing that it now needs to be empirically tested, but this is the hypothesis. We're saying that mental health awareness efforts and rates of mental health problems are influence each other in a cyclical, intensifying manner. So what we mean by mental health awareness efforts are literally awareness efforts like campaigns and public health efforts to raise awareness, but also things like interventions in schools, and even things like sort of celebrities coming forward and saying they have mental health problems. So this general, broad societal idea that we need to notice mental health problems more. So let me unpack that a little bit. So the first bit is sort of unsurprising and makes sense. We're arguing that when rates of mental health problems increase, or reported rates of mental health problems increase, that leads to more awareness efforts. So that makes sense. So we respond to something that's happening, we think things are getting worse, so we better try and do something about it, raise awareness about it, do more interventions in schools, etc. But the paper is really about the opposite relationship. So we're arguing that the more you raise awareness of mental health problems, the more mental health problems increase. For 2 reasons that I've covered already. So the first is improved recognition. This is a good thing, but the more you tell people about mental health problems, the more they're going to recognise these problems in themselves, problems that perhaps were previously unrecognised. So that's good, but it's still going to end up contributing to an increase in reported rates. Then the second issue, which we're much more interested in going into in detail in this paper and that I've talked about already, is that the more you tell people about mental health problems, the more likely they are to over-interpret their own negative psychological experiences as a mental health problem, and then that then can change people's self-concept and behaviour in a way that ultimately becomes self-fulfilling, which again will lead to an increased rates of symptoms being reported. And then we think this is an iterative process. Okay? The more one rises, the more the other rises, and it repeats. Now, we're very clear in the paper that this is an idea, and this is, I think, maybe where it's a little bit different being a psychologist, is that there is then more of an imperative to test and investigate this. Okay? So we've laid this out now as a possibility, and we now want to start thinking if we can empirically document this and test this. And obviously the paper was about society more broadly, but talking about today and talking about what I'm going to look at in Oxford is that I think the same thing could be happening with school mental health lessons. So to come back to what I was talking about originally about the therapeutic turn, this is really, really sensitive, and I'm always very cautious when I write about this and talk about it, and inevitably will always be criticised for saying this. There are absolutely lots of people who really, really need help, aren't getting it. I think some schools are doing a wonderful job. I think it makes an awful lot of sense to try and target this in schools. And there's lots and lots of excellent people doing important work on that side of the problem. I think that's absolutely true and important. But I also think in parallel, cautiously and respectfully, we have to think about whether there's been some collateral damage from these efforts and whether at least some adolescents might actually be feeling worse as a result of these efforts and interventions. So I've written a book about this which used to look like that and now looks like that. I'm going to be looking at this in much more detail in a fellowship starting in January, funded by the Prudence Trust. But if you're interested in this outside of this session, I'd be very happy to hear from you, and those are my contact details. But otherwise, I'm just really interested to hear from this very diverse audience about what you think about these ideas. So thank you.